Good evening, and thank you for joining us. We're going to have an exciting hour. I'm Lee Hamm. I'm the Dean of the School of Medicine at Tulane University. Although 2020 has been a challenging year and COVID has been especially challenging to the medical profession and New Orleans, I'm happy to tell you that the medical school has actually performed extraordinarily well on all levels, clinical, education, research. And so you're going to hear about some of that tonight. And you're particularly going to get to hear from some of our surgical specialties, how they've been doing phenomenal things. Here with us tonight, first, we're going to have Dr. Gabriella Pridjian. Dr. Pridjian is the chair of Obstetrics and Gynecology and also the Associate Dean for Surgical Services. She got her MD from the Medical College of Wisconsin, then did her residency in maternal fetal medicine at the University of Chicago. Also did a fellowship in human genetics at Tulane. She does research in preeclampsia, prenatal diagnosis, pregnancy loss, and metabolic disorders of pregnancy. Also been interested in the business aspects of medicine. She got her MBA and she's been a distinguished member of the medical school faculty for a number of years. Dr. Aaron Dumont is our second panelist. He's the director of the Tulane Center of Clinical Neuroscience and the Charles Wilson Professor and Chair of the Department of Neurosurgery and the Associate Dean and Vice President of Health System Clinical Affairs at the School of Medicine. He completed his residency at the University of Virginia, as well as a fellowship in cerebrovascular, skull-based, and endovascular neurosurgery at the University of Virginia. His interests are in both pediatric and adult neurosurgery, particularly involving stroke and other vascular disorders, spine disorders, movement disorders, peripheral nerve disorders, and tumors of the brain and spine. He's dually trained in open traditional microsurgery and minimally invasive endovascular surgery for vascular disorders of the brain and spine. Dr. Paul Friedlander is our third panelist. He's professor and chair and director of the residency program for the Department of Otolaryngology. He completed his residency and then his head and neck surgical oncology fellowship at Memorial Sloan Kettering. His research is focused on strategies to improve regional outcome for underserved populations afflicted with head and neck cancer. He's been recognized by the American Cancer Society with their Spirit Award and the New Orleans City Business Council and the Clout Ministerial Alliance. He's founder of the Greater New Orleans Coalition on Cancer Disparities, a faith-based organization whose mission is to identify and address health disparities in inner New Orleans. Using his approach in conjunction with other members of the School of Medicine and the School of Public Health to better understand and develop strategies for underserved, afflicted patients with COVID-19. And our final star is a younger star. Dr. Zhang is one of our early career rising stars in ophthalmology. She is assistant professor of ophthalmology and serves as director of the Glaucoma service and the associate residency program director. She got her MD at Yale and then did her ophthalmology residency at Tulane. After residency, she went to the University of Iowa to complete a glaucoma fellowship. And then she returned to Tulane to join the faculty, which we're very glad of. Her research interests include trabecular outflow resistance in glaucoma and the role of MIGS surgery I'm not sure if I'm supposed to spell that or say it, surgery, on the diurnal variation of intraocular pressure, for which she received a grant in 2019. She's also very interested and invested in medical student and residency education, and is working vigorously to improve our educational programs. We're going to start tonight with Dr. Pridjian. Now I'll turn this over to Dr. Pridjian for the first presentation.
Thank you, Dr. Hamm, for that very kind introduction. And it's a pleasure to be with everyone this evening. I'm sure we're always spending time on Zoom, so I even more appreciate that you devote your time to listening to our surgical subspecialties. I'm particularly excited about telling you about our department, the Department of Obstetrics and Gynecology. We currently have 19 faculty members educating and delivering medical care in New Orleans, Metairie, Covington, and even in Alexandria, Louisiana. 2/3 of our faculty are women, and I've been here long enough to see the transition as we've now moved into, at least in our department, a more female-dominated department. I'd like to share my slides with you, so just a moment. So our faculty members represent general obstetrics and gynecology, as well as the many subspecialties in our own subspecialty. Minimally invasive surgery, high-risk obstetrics, maternal fetal medicine, fertility, gynecologic oncology, and OB-GYN infectious diseases. Go ahead. Our major referral sources are in Louisiana and the states surrounding the Mississippi Gulf Coast. Next slide. No, back one, please. Thank you. Our teaching is mostly in the classroom and on the wards, but we have a good deal of education on our procedural skills in our simulation center. Our residents and students love to learn in this center. They learn complicated vaginal births, as you can see in some of the top pictures. They practice safety protocols in labor and delivery, and they work on their fine motor and dexterity for laparoscopic or minimally invasive surgery and for robotic surgery. We train 6 residents per year in a 4-year program, so at any given time we have 24 residents. Obstetrics and gynecology is still a core clerkship, which means that every student who is a medical student rotates through our clinical service. So we have the privilege of working with each one of them. Next slide. Our residents do very well. They match into fellowships such as maternal fetal medicine, medical genetics, pediatric and adolescent gynecology. Many of them go into private practice all over the country, and many of them stay at Tulane in an academic position or take other academic positions elsewhere. Next slide. Our clinical care and research is in a variety of places. The furthest is Rapides Regional Medical Center, where we care for a very large underserved population. We have faculty who actually live in Alexandria, but our residents and students rotate there. Next slide. The VA in New Orleans has veterans who are women. 12% of veterans today are women, and Tulane Gynecology provides their care, and we're very proud of that. Next slide. University Medical Center in New Orleans, our public hospital that's state-owned but privately managed, is where we do gynecologic surgery and subspecialty surgery. And it's a great place for our residents to learn surgical techniques. Next slide. Tulane Downtown is one of our major hospitals where we do complex gynecologic surgery, gynecologic oncology, and robotic gynecology. Next slide. And finally, our obstetric hospital, OB hospital, Tulane Lakeside Hospital, where we obviously do our deliveries and we do benign gynecologic surgery. We are particularly proud of the honors recently received by Tulane Lakeside Hospital, next slide, which is due predominantly to the faculty, the residents, and the staff. Our faculty do research in various areas, both clinical and basic. Some of these areas include hypertension and pregnancy. We're very interested in the reasons why women develop preeclampsia, how to manage hypertension and pregnancy, and the causes and some solutions to preeclampsia. We are currently studying with the Department of Pediatrics, the perinatal transmission of viruses, including the virus that causes COVID-19. We're looking at placental function and trying to see if there's a high chance that the virus does get from the mother to the fetus or to the newborn. We're also looking at the social determinants of why women get or do not get the human papillomavirus vaccine. HPV vaccine prevents cervical cancer. It's just that simple, but it's just not being used as much as we would like to be used. Furthermore, then we also are looking at some recovery pathways so that women can get back to work and back home much faster and don't have to stay in the hospital so much. As we're looking at different factors of how that we could improve that. Next slide. These are the quality and safety awards or important areas I'm very proud of at our Tulane Lakeside Hospital. We were awarded an A in the Leapfrog Group's 2020 hospital safety grade for protecting patients from harm and meeting the highest safety standards in the US. We were the only hospital in the state and one of just 29 hospitals in the country to be named a top teaching hospital. Just 115 hospitals nationwide were given this designation. When COVID-19 started, women who were COVID positive were, the recommendation was to not have them labor with a labor partner. They had to go through labor and delivery alone. But we went against that, did appropriate screening and allowed their one partner to be with them during labor. We have decreased our cesarean rate safely, and our rates are now in the 30 to 32% range. And we continue to work on decreasing maternal mortality, a critical item in the United States. We do this with implementation of certain algorithms for hypertension and postpartum hemorrhage. Next slide. I would like to highlight two of our faculty members. The first is Dr. Cecilia Gambala. She's actually a medical school graduate. She's being highlighted not only because she's an excellent educator, but because of her teamwork and leadership in response to the management of pregnant women during the COVID-19 pandemic. Last March, in the early weeks of COVID-19, we were unclear as to the exact way to manage pregnancy and delivery for these women. We can't exactly put it off, because being pregnant and delivering is not an elective procedure. So she worked with our hospital and wrote protocols and management guidelines that made sense. An entire portion of our labor and delivery unit was partitioned and placed under negative pressure for the care of COVID positive mothers. We had drills for emergency cesareans, for emergency intubations, and operative vaginal deliveries for COVID positive mothers in order to provide safe care for them, as well as safe care for the staff who were caring for them. Again, we opposed the early recommendation that COVID positive mothers should labor by themselves. And we allowed their partners, appropriately screened, of course, to be with them during labor and delivery. Eventually, this became a national recommendation. Currently, all our mothers and one partner are screened for COVID-19 before they enter our labor and delivery hall. Next slide. And I would also like to highlight Dr. Jessica Shank. Dr. Shank is a Newcomb graduate and a Tulane Medical School graduate. And she went off and got excellent training as a gynecologic oncologist at Memorial Sloan Kettering and the University of Michigan. Her belief is that minimally invasive surgery is the best for most cancer patients, and she performs most of her surgeries laparoscopically or robotically. She is also a champion of early recovery after surgery protocols, which she assisted in developing. Both of these interests have resulted in fewer complications and a shorter hospital stay for our cancer patients. Dr. Shanks loves to teach. She teaches minimally invasive and robotic gynecologic procedures to our residents and also to our other faculty. We are very fortunate to have her in the department, and we look for great things from her. You can turn it off now if you'd like. This is a glimpse of our department. It was a quick overview. I hope you enjoyed it. I would now like to pass the spotlight on to Dr. Erin Dumont, Chair of Neurosurgery.
See, thank you. Hopefully you can see my screen here. Thanks very much, Dr. Pridjian. And thank you very much, everyone, for attending this evening. For this presentation, I would like to also introduce Reagan Gankendorf, who's the Administrative Director of the Tulane Center for Clinical Neurosciences and a Tulane alumnus. We've worked very closely together in partnership, so we're going to tag team this presentation as well. And I'm going to focus on neurosurgery, but I'm also going to mention a little bit about neurology because the Center for Clinical Neuroscience is a collaborative effort between neurology and neurosurgery. And I'm sure you'll hear another evening from Dr. Dimitri Maranganori, who's our new chair of neurology, and he'll really highlight the neurology department separately. So when we're thinking about the program in terms of 5-year principles for success, several things I think stuck out in our minds. One was that a robust clinical enterprise provides the foundation for our research and education programs, and you'll hear a little bit about those as well during this presentation. And Tulane Medical Center, at least for neurosciences, we believe must become a tertiary or quaternary center for complex neuroscience care. And we'll go into this in a little more detail, but we had this hub and spoke model as a critical component of that. We also believe that faculty subspecialization is really important with complementary clinical and research interests. So that's to say that a faculty's clinical interests ideally would complement what their research interests are. For example, vascular neurosurgery, spine neurosurgery, etc. We also believe that strong resident, fellow, and medical education is critical for a successful neurosurgery program. And we also believe that the operating room, the angio suite, where we do a lot of our cerebrovascular and stroke work, as well as the clinics and hospital, must be used as an extension of the laboratory and as sites for clinical research. And Reagan's going to highlight some of our research programs in a moment, so we'll get back to that. High impact translational research, in addition to clinical research in areas corresponding with our clinical strengths, must be established. And then, as for any organization, I believe that it's really important to recruit and retain the very best people at all levels of the program. So for this academic year, we currently have 9 neurosurgeons covering all specialty areas, and we're in the process of recruiting a 10th. We have 19 neurologists with broad subspecialty expertise with ongoing recruitments in multiple areas. We have 9 mid-levels. We have 11 research faculty, research intensive faculty, which Reagan will talk about in a moment. And then our practice sites include Tulane Medical Center, Lakeside Hospital for Women and Children, Lakeview Medical Center in Covington, University Medical Center, East Jeff, and Ochsner as well. One of the principles behind trying to establish, at least for neuroscience, Tulane as a tertiary or quaternary referral center was to try and create a hub and spoke model, namely that Tulane Medical Center would be a hub and try to provide a resource for community hospitals in our region. And the principle was that we wanted to establish a regional network in Louisiana and Mississippi pertaining to neuroscience. And these hospital partnerships were really for advancing care in the region. So it was a mission-based initiative. And it included community-based specialists, shared clinical protocols. So we would share our best practices with these hospitals, provide access to clinical trials for patients, provide community education through support groups and formal information, seminars, and webinars. also offer CME and CEU programs, offer priority transfers only when a higher level of care is deemed necessary, provide consultative services, and offer a remote presence through telemedicine. And this is an overview. We've to date created a 17 hospital network, 17 hospitals outside of the 3 hospitals which currently comprise Tulane Health System, extending from the north of the state to the west, and then to the east to Gulfport and so forth. And I think that this has been really successful for our program in terms of being able to offer patients from a wide geographic area complex specialty care when necessary, but also serving as a resource for the community. And we're currently also looking to expand. For example, yesterday we met with a 7-hospital health system in Mississippi that we've begun discussions with. And the principle, one of the ways that the program initially started was through offering Telestroke. And the idea was for patients that come into our spoke sites, we would immediately log on. They would contact our transfer center. We would log on, assess the patient at the bedside through our robot, and talk with the patient and their family, and then decide in terms of stroke whether or not the patient would be a candidate for IV TPA, which is a clot buster, as the audience is aware. And if they're a candidate for that, or whether or not they may have what we call a large vessel occlusion, where we may have to go in and extract the clot through an endovascular procedure. With the program, the majority of patients, about 76% of patients, are able to remain in the community. And when a higher level of care is necessary at Tulane, for example, to extract the clot, we're able to expedite the transfer to provide that service. I think other programmatic highlights include, we have a Joint Commission certified and award-winning comprehensive stroke center since 2013. We provide comprehensive subspecialty care with expanded access sites and telemedicine offerings. We have multidisciplinary programs, which we're really proud of, to handle the most complex problems. For example, spine, in collaboration with orthopedic surgery, physical medicine and rehabilitation, physical therapy, and so forth. Stroke, neuro-oncology, which is a multidisciplinary endeavor, movement disorders like Parkinson's disease, and so forth. And then another aspect of the program we wanted to highlight is that Tulane Neurosurgery has been a pioneer in the field of stereotactic and functional neurosurgery. Dr. Don Richardson, who was the chair for about 30 years, was one of the first people and really a pioneer in deep brain stimulation, DBS, surgery. And one of our neurosurgeons, Dr. Rob Della Piazza, continues to pioneer treatments for a number of conditions, movement disorders, as well as certain psychiatric disorders like obsessive compulsive disorder. And then recently, as I mentioned, Dr. Maraganori is our new neurology chair, and you'll hear more about this in the future, but we're really excited that Tulane has launched the multidisciplinary Healthy Brain Aging Initiative, which is designed to help patients prevent cognitive decline and dementia, including Alzheimer's disease, and to reduce the burden of those afflicted already established with Alzheimer's disease and related disorders. We use cutting edge technology. We have a hybrid operating room where we're able to treat patients minimally invasive through the groin or through the wrist endovascularly. But if we need to, we can convert immediately in the same room to do an open surgery like a craniotomy to repair, for example, a brain aneurysm that has bled. We've been the first in the region and in some instances, the United States, to use new technology for endovascular therapy. For example, we're one of the first to use this device, which is basically a basket used to fill the inside of an aneurysm in a minimally invasive fashion, the Webb device, as well as the Fred device, which is a flow diverting stent to help repair aneurysms in a non-invasive, minimally invasive fashion. We're also the first in the region to use spinal robotics. And under the tutelage and leadership of Dr. Christopher Malucci, we're a national training site for spinal robotics. So those are just a few of the clinical highlights. And I'm going to turn this over to Reagan to discuss some of our research pursuits.
Thank you, Dr. Dumont. We developed the Clinical Neuroscience Research Center, which we're calling the CNRC, in August of 2019. So fairly recently, about a year ago, a little over a year. The mission of the CNRC is to establish a world-class translational and clinical research enterprise. So really what we're trying to do is develop novel therapies for stroke, dementia, and traumatic brain injuries. So looking at ways to prevent and treat these issues and improve patient outcomes subsequently. In addition, we have an anatomical research facility where we are looking at medical and surgical problems. So basically, if a physician has a medical or surgical problem, we take it to the lab and we figure out how to work through that problem and therefore improve patient outcomes as well. So we've done a lot in the last year. We have 21 people that are in our Clinical Neuroscience Research Center. We have 11 faculty members that are covering the areas that I described before of stroke, dementia, and traumatic brain injury, 4 postdoctoral fellows, and 6 research staff. They are funded in large part by external funding. We have 10 NIH funded projects, and we are applying for external funding every cycle. We have current clinical trials, industry sponsored projects, many active IRBs, and in just a little over a year, we've had 250 peer reviewed publications in these areas. So Dr. Dumont, I think you'll be turning it over to Dr. Friedlander.
Yeah, just going to see if I can unmute myself. Thanks, Reagan. And we didn't talk a whole lot about our training programs, but we're really proud of our residency and fellowship training programs, which we could highlight another time. Our next speaker will be Paul Friedlander. As Dr. Hamm mentioned, he's professor and chair of the Department of Otolaryngology, ENT.
Good evening, and always wonderful to just in awe of the accomplishments of my colleagues. And before getting started, certainly want to thank Dr. Hamm, the leadership, for allowing us to go present today and discuss some of the highlights of our department in response to the COVID pandemic. None of our successes would have been possible without the dedication and effort of Tulane University, because Tulane provided us the environment to let us continue our patient care missions, medical and resident education, and really researching in a safe environment. The Tulane did a fantastic job in terms of the protocols. We really didn't have much to worry about. It's the COVID protocols are safe, and we really could concentrate on taking care of what we need to take care of. And really the countless hours of hard work are appreciated by all of our residents, faculty, and certainly by myself. If we can get the next slide. I haven't had the opportunity to meet many of you on the call, and Zoom sort of doomed to me. That's why I'm just handing these slides over. But before we could discuss and embark discussing the highlights of the department response to COVID, it's probably a good idea to have a little context of what the department is. And again, maybe you guys can just go back beforehand, before January, before COVID, and just think about a different place of time. But our department's the 3rd oldest ENT department in the country. We train 3 residents a year. It's 5 years of training. About half our graduates enter what historically was private practice, multi-specialty groups now, but half pursue fellowships and enter academics. What our major pride is our graduates and our Tulane alumnus, because we've got graduates on faculty at many prestigious institutions such as Mayo, Emory, Georgetown, UCSF, and Yale. And our educational platforms, sort of like with OBGYN, we've got multiple training sites that the residents work out of, not Alexandria, but a lot of similar ones. And these training sites are interdependent. And before COVID, we really did have a very cozy situation. If I can get the next slide. Like for everyone, 2020 was a year of transformational change. And again, unexpected challenges. The major challenge, the first challenge our department had was the loss of our dear colleague, Dr. Mary Fazekas. Mary was chief of ENT at the VA for over 30 years, and she was just a tremendous educator, patient advocate, and tremendous colleague. And she succumbed to sudden illness in March of 2020. COVID hit right after that, and we all have got our own perspective of COVID. But for otolaryngology as a field, COVID was we were significantly affected. We're one of the major specialties, like our colleagues in ophthalmology and dentistry, that really have face-to-face contact with the patients. So before COVID struck our shores, internationally, there were a lot of ENTs that succumbed to COVID, and we were a high-risk group. We worked together nationally, but realistically, a decision was made to take our specialty offline. This is really from a national standpoint for the first 2 months of the COVID pandemic. All office-based procedures were stopped. Surgical care was limited to true emergencies. And the major challenges was that the procedures we have in the office were aerosolizing, and we were at high risk for infection. So this posed significant challenges for patients, residents, and also for medical student education. If I can get the next slide. The value of working at Tulane University really became apparent as we had to go and stabilize our department. Tulane is an institution of relationships with outstanding human capital. Again, faced with these challenges, I was immediately able to reach out to John Schifflin and Dr. John Schifflin and Dr. Robert Gary of infectious disease and virology. And if you don't know these gentlemen, they are just simply brilliant and wonderful, wonderful people. Immediately, we had discussions of what ENTs don't know about aerosolizations. We were able to design safe protocols to resume our clinical practices. And working with Dr. Schifflin and Dr. Gary and Dr. Haynes of anesthesia, we were also to help design safe surgical protocols to let the institution get back online. And really, we're very proud of this because to date, our department's had 0 infections that are related to clinical care. And this has allowed us to quickly resume resident training and medical student education without lapses. If I can get the next slide. So what do we have to do in response to COVID? Working with our leadership at UHC, we had to completely redesign our clinical platforms. Beforehand, we had an ENT clinic that was based downtown. This encompassed general otolaryngology, head and neck cancer, as well as hearing and balance neurotology. And we really, with aerosolization, we had to go and shut that down. We repositioned our head and neck cancer practice in the Tulane Cancer Center. And what this did was afforded our patients instant access to our colleagues in medical oncology and radiation oncology. Likewise, Dr. Dumont and his team was kind enough to give Dr. Jackson, our neurotologist, a new home in the Neurosciences Center. So Dr. Jackson was able to transform his practice from dealing with hearing imbalance to work with Dr. Dumont, Dr. Amenta, and multiple colleagues to address complex skull-based disorders, providing the highest level of care. And again, from general ENT, we went ahead and transitioned our clinic from downtown over to Metairie. If I get the next slide. From the VA standpoint, we also had to do, we achieved some operational success in the VA. We went ahead and working with the VA leadership, we went ahead and found areas that we could do these aerosolizing procedures in negative pressure areas and quickly resumed our practice. My partner, Dr. Jackson, it's fun to go and brag about Neil, but Neil, our neurotologist, established the first cochlear implant program at the VA. And this had to get national accreditation. We're the only area of cochlear implants in the 3-state area, and other VA centers in Houston or in Birmingham. So we're in a tremendous growth phase there. We're also beginning a telemedicine program, which will help us connect to our veterans and really decrease the travel time and hopefully decrease the risk of COVID transmission during this time period. And we're working with an lean project to work on areas of healthcare delivery. Get the next slide. Our goals are lofty for 2021, and we're really confident that we're going to continue to do quite well. Our goal is to expand our neurotology and vestibular program. Right now, we've got the vestige of an outstanding program at the VA and at Tulane, but our goal is to develop a hearing and balance center over at Tulane and to recruit a second-year surgeon, second neurotologist. Our head and neck cancer practice, we've got my partner, Dr. Riz Aslam, is internationally known for robotic surgery. And we're really going to go ahead and continue to pursue this area. Again, from a research standpoint, one of our foci is working in healthcare delivery and healthcare disparity. For the underserved, the outcomes are low. If one's African American, one is twice as likely to die of head and neck cancer. And if one is of low socioeconomic status, one's 3 times as likely to die of malignancy. So we're continue to work on research in this area. Other areas for expansion of research, I'm excited to announce that Dr. Jaime Garza has joined our team. Dr. Garza is very well known over at Tulane. He's a member of the Tulane Sports Hall of Fame, football player. Last time Tulane beat LSU, he played for the Saints for a while. But outside of this, he's another otolaryngologist who pursued plastic surgery up at Pittsburgh. He's been living in the San Antonio area for a long period of time. Was really head of plastic surgery over at San Antonio. But what his research interest is in stem cell research. He's currently working with Dr. Savoy, the Department of Orthopedics, and working on clinical trials for stem cell research. He is going to be joining our department clinically as well. And we're hoping to go ahead and use his expertise and collaboration to look at traumatic brain injury at the VA. In other areas of interest, we'll be pursuing healthcare delivery. So again, we're very optimistic for 2021, and certainly really want to thank the leadership of Tulane to afford us the clinical and educational platform to be able to continue these pursuits. So again, I've got this pleasure to go and hand this off to my colleague, Dr. Zhang of our ophthalmology department. Thank you.
Thank you, Dr. Freelander, and I want to thank Dean Hamm, the School of Medicine, the whole team for this opportunity to speak and share with you some of the exciting things happening in our department currently and also for the future. It's a true pleasure and honor to be here and to be on a panel with such a distinguished experts in the various surgical fields. So we're a smaller department. We're a department that's expanding. We currently have 7 full-time faculty, soon to be 9 full-time faculty, and over 15 part-time faculty who work in New Orleans, as well as in Alexandria, as well as in Biloxi. All of our faculty help teach our residents as well. So perhaps the most exciting and also the most immediate news and change in the department is us welcoming a new chairman in January of 2021. After 4 decades of incredible service and leadership by our current outgoing chairman, Dr. Caldwell, we were very excited to welcome a new leader to our department, Dr. David Hinkle, who will serve as chair and professor of ophthalmology, and he will also hold the Oliver and Carol Dabazies Endowed Chair. The Dabazies Endowed Chair is a generous gift from the Dabazies and the Goodyear family, who have donated $1.5 million to the Department of Ophthalmology to support the chairman's clinical research and professional service work. Dr. Dabazies was an expert on contact lenses and was a faculty of Tulane and helped write and create regulation that's been adopted by the FDA to prevent contamination and blindness related to contact lens products. Our new chair, Dr. Hinkle, comes back to Tulane. He did his residency training here at Tulane and completed a uveitis fellowship at Harvard, as well as a surgical retina fellowship at the Albany Medical College. And he's currently finishing up his work at West Virginia University, where he's been on faculty for a number of years, has many years of experience doing clinical research, as well as teaching residents, fellows, and has been the leader of the retina section at West Virginia University for many years. Dr. Hinkle also brings very exciting research with his return to Tulane. Recently, he published a landmark paper in JAMA Ophthalmology, highlighting an under-discussed but somber aspect of the ongoing opioid epidemic and how it affects patients' vision due to a steady increase in blinding infections related to IV drug use. Dr. Hinkle has discussed this in a landmark paper and the important findings with multiple major news organizations, including US News World Report, as well as Medical Daily. And he will continue to work on this important research when he comes to Tulane, really highlighting the critical part that we play in taking care of our patients with systemic comorbidities, as well as socio and economic issues. The glaucoma section in our department is also expanding. We've hired Dr. Crystal Lee, who is a former Tulane ophthalmology residency graduate who joins us from the University of California, San Francisco, and she will join us in early 2021 as well. So in addition to myself, we have also started a new glaucoma fellowship that is AUPO certified, and we will provide premier fellow and training and education that will greatly boost our mission in education. The department and the glaucoma service has also received a prestigious MAPS grant through the American Glaucoma Society, supporting our clinical research. In this one, we're looking at 24-hour blood IOP monitoring, intraocular pressure monitoring after angle-based surgeries using a brand new system called a Sensimed Triggerfish, which is a contact lens-based system that allows us to monitor a patient's eye pressure for 24/7 continuously and looking at the pattern of change over a diurnal variation. In addition, the department is also involved in several large clinical trials. We are part of the Glaucoma GOS study, which is a large study funded through the American Glaucoma Society assessing patient-reported surgical outcomes in minimally invasive glaucoma surgery. This study will help validate a new tool that will help us examining new endpoints in glaucoma surgery-related clinical trials, enhancing the way we look at surgical procedures and their outcomes. We're also continuing to actively recruit for the second portion of the Vimatopros SR study, which is a study where we're studying the safety and efficacy of the first of its kind slow-release drug that treats glaucoma, decreasing the need for using topical drops for patients, and also increasing treatment efficacy, therefore greatly increasing the patient's quality of life while decreasing cost. I will also continue to be involved in the world-renowned MediTread online ophthalmology platform, where we provide online board review as well as lectures and question banks for trainees across the world. Most recently, because of the COVID pandemic, all of the review courses for ophthalmology trainees as well as ophthalmology graduates, of course, had to be canceled, and therefore MediTread actually served as a great resource for all ophthalmology graduates in preparing for their board exams. And for the second year in a row, Tulane faculty will be the course director for this course as well. In our cornea section, Dr. Rebecca Metzinger, who's a cornea specialist and also chief of ophthalmology at the VA in New Orleans, she has received a patent for her revolutionary contact lens disinfecting solution called Asepticus. She's also currently involved in a large multi-center clinical trial for this solution. The solution includes a unique disinfecting technology that is able to likely create a new benchmark for contact lens disinfection, including preventing infections from bacterial, fungal, as well as amoebic pathogens. On the other side of the cornea hall, Dr. Jody Simon, also a cornea specialist, has recently helped bring corneal cross-linking to the VA in New Orleans, and the Tulane-led cornea service has provided corneal cross-linking for the first time at a veterans hospital. The first veterans, in fact, who came and benefited from this surgery, which treats corneal ectasias, including keratoconus, actually transferred to the VA New Orleans from the Manhattan VA. And since then, many patients have been referred from all across the United States for this procedure at the VA in New Orleans. And additionally, our outgoing chairman, even though he's stepping down his chair, is still a giant in ophthalmology and a pioneer of many surgical procedures over the years. And he continues to work hard at finding novel ways to treat patients in cornea and external disease. He's currently studying the use of a special proprietary gas for corneal infection treatment that could potentially revolutionize the way corneal ulcers are treated by providing a minimally invasive and effective way to treat ulcers. Additionally, he continues to work with his international partners on the Caldwell keratoprosthesis, which is a corneal prosthesis that could potentially provide vision to many patients with corneal blindness. And then finally, but not least, one of our proudest parts of our program is, of course, our residency program. We train 5 residents per year across several sites in New Orleans, Alexandria, as well as Biloxi, led by our program director, Dr. Peter Castle. And we're incredibly proud to continue to train the best and the brightest in ophthalmology. But in addition to the incredible breadth and depth of training that we offer, our program also regularly ensures our residents become certified in the latest and most innovative surgical platforms and technologies, including MIGS, minimally invasive glaucoma surgeries. We're also one of the only programs in the nation to ensure our residents are consistently certified in femtosecond laser surgery prior to graduation. And this is allowing our residents to be ready to provide the best and the state-of-the-art care for their patients immediately upon graduation using the latest technology. We also encourage and support our residents in pursuing volunteer and service work, both domestically and abroad. Our residents regularly have opportunities to go to mission trips in Mexico to provide eye surgery to those much less fortunate than us in Mexico. But additionally, we recently also started a fully funded program to support our residents taking trips with the Hawaiian Eye Foundation to the South Pacific to provide service trips as well. So again, I want to thank everyone for listening in today. I'm going to turn it back to Dean Hamm.
Well, thank you very much to all the panelists. You know, I always think I know the departments well, but I learn something new every time, and exciting things. So this has been great for me as well. We do have some questions that have come in from a couple of different directions. We had one that came in the chat that I'm going to start by going to Dr. Pridjian, and it's about the HPV vaccine. And what's the youngest age that females can receive the HPV vaccine, or, you know, anything that you think our listeners or attendees might like to hear about this?
Well, as you know, the human papillomavirus vaccine is a great preventative strategy for cervical cancer. So actually children should be getting this through their pediatrician. It's the first dose is recommended at age 11 to 12, although the youngest was 9 years of age. So it's not inappropriate to start the doses or the vaccinations at 9 years of age. But just a caveat, it's girls and boys that need to get it, not just the girls. So just because the girls get the cervical cancer, boys can also get a penile cancer associated with HPV infection as well. So it's important to do that. And it's also, in my mind, important to do it early. The recommendation is to get the vaccine before you're 15 years of age, because then you only need 2 doses. As we age, our immune response is not quite as good, perhaps. And if you start the series of vaccination after 15, you need 3 doses. And the oldest to get it, if anyone's interested, is around 45 years of age.
Excellent. Thank you. Let me turn to Dr. Dumont. Aaron, you mentioned a lot of different things, but what's both the greatest strength and the greatest area for growth?
So I think the greatest strengths of the program are probably, without question, our people. I think faculty, administrative team, employees, staff. I think that we really enjoy working together, and I think we have a great team. So I think that's the greatest strength. And another strength, although it may sound trite, is that I think being part of Tulane University, because I know President Fitz has tremendous vision, and he frequently states great universities have great medical schools. And then, of course, you have a bold vision for clinical programs, research, and education. And we're given, as department chairs and clinicians here, I think flexibility, but support. And that allows us to do, I think, some pretty incredible things. So I think those are the greatest strengths. And then in terms of opportunities for growth, I think that continuing to capitalize some of on our faculty strengths and expanding our network through affiliations with other hospitals and building our referral base, I think, is a huge opportunity. And then I think recruiting and retaining the very best people, so new recruits in strategic areas.
Good. Well, thank you, Aaron. Dr. Friedlander, I wanted to ask you about telemedicine and how you're, some ways that you're going to be using that, which I understand you are.
No, thank you, Dean Hammond. Telemedicine is really, it's an amazing thing. This was one of the areas I learned the most during COVID, because again, I'm not tech savvy or anything like that. The initial concern as a head and neck cancer surgeon was that through using telemedicine, I would actually lose contact with my patients. What I found out is during COVID, when we're in the room with patients, a lot of our appearance and personality is our face. So oftentimes we're seeing patients it's like this with the mask on. It's very hard to communicate with people. And so we found out by adopting a telemedicine platform that after we see patients at the clinic, we actually could have very, very meaningful conversations outside the office over in the home. And really, it really turned this area down. Over at the VA, there's a huge telemedicine component. And what we're really doing over there is to capitalize on those strengths. And from the veteran standpoint, specifically those afflicted with cancer, we're looking at telemedicine as a way to efficiently reach out to people, to connect with them earlier, and to be able to have very in-depth conversations where they don't have to travel, oftentimes a very far away to go to the clinic. So we're really trying to embrace the spirit of a transformational change and looking at how we can use these Tulane values and Tulane principles to help redefine the healthcare system.
Thank you, Paul. Dr. Zhang, I wanted to ask you, you mentioned this glaucoma study. Can you tell us more about that and why it's important?
So, the glaucoma outcome study that I'm really excited about us participating in, it's a big study and national study across multiple large sites where we're looking at the impact of glaucoma surgery, particularly minimally invasive glaucoma surgery, on the patient's quality of life. And the reason is because when we're doing glaucoma surgery and doing minimally invasive glaucoma surgery, what we're trying to accomplish is to provide the least amount of risk for moderate efficacy and benefit. And, so I think we'll all agree that the best quality of care would incorporate the patient's voice. So there's definitely a movement in ophthalmology in trying to capture the patient's quality of life as a clinical endpoint, in addition to traditional clinical endpoints like intraocular pressure or visual acuity. So I think ultimately in the direction that clinical research is moving in ophthalmology in the world of glaucoma is that we're also going to incorporate patient quality of life as a clinical measure. And this study is going to help us validate a series of questions that we can ask the patients to see whether or not that is an effective way of measuring the patient's quality of life in clinical trial studies.
Good, thank you, Dr. Zhang. Well, I think we've taken up almost all the time. We've not gotten to every question. I think if you have some burning question for one of the panelists or really anyone else at Tulane, hopefully you can get in contact with us fairly easily. I want to thank all the organizers, Cynthia Hayes in particular, and also the panelists for giving us a real flavor of all the exciting things that are going on in your various departments. They represent some of the best things going on, but there is lots of exciting things going on at Tulane. And we really appreciate your attention. We appreciate your support. And with that, we'll sign off. Thank you very much. Thank the panelists.
Thank you.